Hi everyone, and welcome back to Tiny Airways Big Impact. I'm Nateenee, oral health therapist, orofacial myofunctional therapist, and the founder of Dental on Wheels. Today we're talking about something that has received a lot of attention in the recent years, tongue ties. Most people have heard about tongue ties in babies, especially when breastfeeding challenges are involved. But what many people don't realize is that the tongue ties doesn't just suddenly disappear as the child gets older. In fact, I often meet children in daycare centers and schools where have never been assessed, despite showing signs that makes me curious about how their tongue is functioning. Before we go further, let's clear up a common misconception. A tongue tie isn't simply about how the tongue looks. It's about how the tongue functions. A child can stick their tongue out and still have restriction that affects breathing, chewing, and swallowing, speech and sleep, and jaw development. The tongue has an important job. It helps shape the jaw of a child as they grow. It supports nasal breathing. It helps with chewing and swallowing. And when resting correctly, it should sit gently on the roof of the mouth. When the tongue movement is restricted, the body often finds other ways to compensate. I commonly see children who mouth breathe, have difficulty chewing certain foods, prefer soft foods, whole foods in their cheeks, or struggle with tongue movement, or have a messy eating habits, have crowded teeth, and have narrow palate, snore or sleep with their mouth wide open. Having one of these signs doesn't automatically mean a child has a tongue tie, but it does mean that we should stay curious and look at a bigger picture. One of the biggest lessons I've learned is that we should never look at one symptom in isolation. Instead, we ask, how is this child breathing? How are they growing? And how is their tongue functioning? Because that's where the real answers often live. I also want parents to know that tongue tie assessment should never be rushed. A release isn't the first step for every child. We need to understand the function, the habits, the airway, and the child's overall development. Sometimes children benefit from support such as myofunctional therapy, speech therapy, your body work, or airway assessment alongside the care. Every child is different, and that's why the team approach is so valuable. If you're listening today, here are a few questions to think about. Does your child rest with their mouth open? Do they struggle with certain texture? Do they snore or grind their teeth? Do they have crowded teeth? Developing early? Have you ever wondered whether their tongue is functioning as it should? If so, it may be worth exploring further with appropriately trained healthcare professional. Remember, the goal isn't to look for problems. Understand how your child's body is working and whether there are opportunities to support health, growth, and development. Thank you for joining me for another episode of Tiny Airways Big Impact. Until next time, keep looking beyond the teeth and support the whole child. Bye for now.